Hello everyone, this is Bob Browner. An update on our REACH data as you enter year 2 of our CDC contract. So we're working on data from a couple different angles to evaluate the progress of the CDC grant. The intent is to lower health disparities in Lincoln's African American and Hispanic communities, but we do hope it'll indirectly reduce disparities for all Lincoln residents. Some of these things are system fixes, and if we fix it for one group, likely we'll fix it for multiple groups. There's quite a few REACH-funded partners. Here's all of them listed here. I won't read them off one at a time because you can read faster than I can talk. But here's the group that's working on this project. We have three sources of data. The first is Lancaster County birth data. This comes from Vital Records, so every child that is born in Lincoln, Nebraska does have a birth certificate that has a lot of health-related data of both the baby and the mother. And these are updated and compiled annually and with assistance from Tommy George at the Health Department. And we've been reviewing this data, and here's the results that are updated because we now have 2018 data. So one of our big wins in Lincoln, Nebraska is our increasing rates of breastfeeding. We've increased from 81% in 2007 to 94.2% in 2018. So this is a pretty dramatic increase in breastfeeding rates. It's probably reflective of the nation as a whole. However, Tommy, this time has added state level comparison, so you can see that we're about 5% higher than the rest of the state. I like to think this is because of the projects we've been working on in Lincoln that has caused us to get better. And the good news is we're seeing dramatic improvements across the board. So for example, with African Americans, you're seeing an increase in the 70s to all the way to 89.1% last year. Same with Hispanics, going from 83 all the way to almost 93%. And you're seeing it across income strata, with the biggest improvements actually coming in the Medicaid population, going up from 73.8 to 90.7. So you've got pretty much a 17% absolute increase, which is really helpful. And so this is probably one of our biggest bright spots we're seeing from maternal child health in Lincoln, Nebraska. Women do want to breastfeed, and it looks like they're trying. Other things we see that the cesarean section rates are not too off of what you'd expect in nationwide, and there's not a lot of disparities here. So it's kind of nice to see that, at least in this area of birth numbers, that most of the numbers are pretty consistent and not showing anything that I think we need to really specifically address at this point. Gestational diabetes by maternal race has been gradually increasing. You'll notice that for this one we used a 3-year running average, and the reason being is that when the sample sizes are really low, it gets to be really to shoot around a little bit, and by using a 3-year running total, it gives us a better sense of a long-term trend. And you can see that overall the rates of gestational diabetes are going up, unfortunately. It's across both Medicaid and private health insurance, and across most ethnicities. So this probably is a reflection of our obesity epidemic. Again, we need to get everybody to be more active and especially avoid those refined sugars. But unfortunately, we are seeing an increase over time. Low birth weight, we're not seeing dramatic changes. They're fairly consistent, but the biggest thing we do is definitely there is a disparity on socioeconomic lines, with lower income women having much higher rates of low birth weight. And you'll see the biggest numbers in African American population, which is not pretty commonly seen across the country. This is something we do need to try to work on in the future. One of the things is going to be early access to prenatal care, which I hope will be a focus in the next year across Lincoln. Gestational age of delivery, that means preterm births, and again you see some of those same disparities a little bit on socioeconomic lines, with Medicaid having a higher rate of before 38 weeks to deliveries as opposed, and also a little bit of race and ethnicity variation as well. One of the things we can do to hopefully reduce some of these bad outcomes in pregnancy is if we can make an increase in our early access to prenatal care and women getting in at least 10 prenatal care visits. Again, you'll see that the rates are lower in the lower income population, and also for some ethnicities, especially the African American, Asian, and Native American communities. So this is something we might be able to try to work on as a community. Can we get women into pregnancy and maternal care earlier and get things sharing up more regularly at their appointments? Maybe this is something the ethnic community centers could take on, something we can do in those neighborhoods. So I think this is something I hope we can get some support in the community for. Access to prenatal care, we have a little bit of a data issue here in that there's two different ways. The state has apparently a lot of missing data in this, for example. We're going to do some work here in the next 6 months to see if we can track down why there's so much missing data around first trimester care. If we look at the numbers excluding missing data, it looks like the rates are pretty stable across time, so there's not huge changes, either good or bad, unfortunately. But there is definitely a strong socioeconomic component where those on Medicaid are much less likely to get into early prenatal care, and also some disparities on ethnic lines. When the state actually reports rates, though, it extrapolates the missing data and it causes a lot of fluctuation, and I'm not sure what's going on here. So we're going to try to track down what the state is actually doing here, because this, to me, doesn't make a lot of sense that you'd see these uh, wide variations. This would something I would suspect would be fairly stable across the population unless something else is going on. So we do have a potential data integrity issue when it comes to how we're tracking first trimester care. Adequate and intensive prenatal care is again showing some of those same changes. Some of these could be the economy. So, for example, here the recession hit and suddenly you see a big drop, but some increase over time. So, hopefully, there's something here. But again, this actually takes into account that access to prenatal care, which could be wrong. Another interesting thing that also is another good success, which is really nice to see, is that we're having a very large decrease in births to teen mothers. So our teen pregnancy rates are dropping pretty dramatically, and it's happening in the Medicaid population. So on people who are lower upper income strategy, theirs has been pretty stable. It's pretty low to begin with. We're seeing a very big drop from 13, 14, 15% down to the 7 and 8% range. And so this is a potential another success story in Lincoln, where we're seeing a very dramatic decrease in teen births. So good, another thing to be happy about. We're also, of course, continuing to work on Lincoln Public Schools health and fitness data. We're going to continue tracking, I hope, aerobic fitness over time. I've been working with Matt Avey and Rob McIntyre from Lincoln Public Schools on this for about 10 plus years now. Um, we have, of course, in the past seen pretty big improvements in aerobic fitness, which we hope will continue. Our biggest concern is that dip in the Hispanic fitness rate. Nationally, there's data on a lot of things related to Hispanic populations. The leading cause is that it's actually fear that Hispanic population, because of the political climate, is not accessing services and getting out as much. There's a DACA article about declines in the health of DACA recipients and their children that came out in Health Affairs just this year, again, thinking that a lot of it had to do with political climate. And even here in the Lincoln Journal-Star, there was article about the uninsured rate, and that fear may be the reason. So I do think there is a bit to this. The thing that has changed since the last recording is we do now have the fitness map that Community Health and Environment's been put out there. So not only do we have some disparities on ethnic lines, we can see some geographic areas where we have low rates of aerobic fitness in children. It tells us that in these areas we need to probably put some community level interventions. It probably does track bound to socioeconomics, but could even be neighborhood design. One reason we had Streets Alive in the park in Cooper Park and Park Middle School area was because this is one of the areas where we have low aerobic fitness, just like we were in Belmont the year before. It's ways to try to get the park to be more of a happy, safe places where kids are more willing to get out and play. We do need to find ways to try to do this. And I think it's some of these solutions are going to be neighborhood level solutions. As you can see in the wealthier areas of Lincoln, we have kids that are over that 80% goal of being aerobically fit, some even 90%, which is even better. You'll see this bright spot here. Well, that's Sheridan. So from a socioeconomic, that's the Sheridan Country Club area, so doing better. So again, back to the socioeconomics, we hopefully can do some things in that environment. Last thing we're working on is diabetes control with our safety net clinics. Blue Stem Health, Lincoln Family Medicine Center, and Nebraska Urban Indian are three of our biggest safety net clinics that serve the low-income population. And so we're working over time to see if we can improve not only their overall control of diabetes, but also looking specifically at the ethnicities. And so we have been working with them to break down this data, and we're seeing actually a gradual improvement. So the April where we started versus June versus October, we're tracking this every quarter. I hope to continue to do so in the future and see if over time we can make things better. What you see with the running total is that we do see a gradual improvement. I'm not sure we can attribute this improvement to the grant. Maybe some pre-existing things that were being done in these clinics to improve their diabetes care, and both two of those clinics are working on ACO contracts. Three of them are working on a state contract on quality improvement. So probably some results of that, but we'll also keep tracking this over time. We are going to roll out some things with community health workers with El Centro de las Americas, the Asian Community Center, and the Loan Center here in the coming year, and hopefully we'll make this continue to improve over time. So we are seeing some decline already. I don't think we can claim all that benefit coming from the CDC grant because there's other initiatives ongoing in Lincoln that can make that better. But again, we want to see this continue to improve. So hopefully this is helpful to y'all. And if you have any questions, just send me an email. I'm happy to respond. Thanks.